Why does my body do that? Now, we all know your babies can't ask you that, but there are other ways you can decode your baby's health. Some of them start in the diaper, Dr. Jim.
You just look at the diaper and it can give you some really great clues on how baby is doing. Now, there's a lot of colors you're seeing here, right? And so I'm going to talk about which ones mean what for the baby. Now, first, when a baby's first born, those first couple of days, their stools are going to look like kind of a black, greenish, tarry substance. It's called meconium. It's going to look kind of like this. Now, this isn't actually stool. It's the stuff that's been sitting in the baby's intestines for a long time. You know, there's some amniotic fluid, some old skin cells, some mucus in there. And this doesn't really smell too bad at all. So you may not even know it's in there. So that's why you got to check the baby's diaper pretty frequently. Now, when the baby starts really digesting the breast milk, it's going to turn more of a yellow color like this, all right? Now, a breastfeeding diaper actually kind of tends to have more of a sweet smell to it, and it will literally look like somebody just squirted mustard and cottage cheese, mixed it up and squirted it into the diaper. It's going to have that yellow, kind of some curds in there, maybe some seedy stuff, kind of like that Dijon look to it. Now, if the baby's formula fed, it could be a little variable. You could more get a green pasty look to it, or more of a tan kind of peanut butter look to it, all right? So green or brownish.
Normal variations.
Normal variations. Now, in general, if the baby is always having the same kind of poops and then it changes, that's something to think about. Like if a breastfeeding baby, if it suddenly starts turning green a lot,
without any changes.
Well, without, you know, right, without anything else going on in the baby, it might mean that they're not nursing on the one breast long enough. They may be getting too much of the watery milk, not enough of the fatty hind milk, so they're kind of finishing too quickly. So have that baby breastfeed longer on the one side. Or if you know, whether it's formula or breast, if you're starting to see mucousy streaks in there, stringy streaks, or little chunks of what looks like jelly, like clear jelly, that's often a sign of some sort of allergy or even infection, some sort of colitis even. And then if you're starting to see a tinge of red, all right, this is the last one over here. You know, that would be something definitely to call the doctor about, you know, because, you know, blood in any baby stool, yes, it can happen maybe once and not be a problem, but if it's happening more than once, we want to look for something. It could be a constipation, or some sort of allergy, or even infection in the intestines, something to look at.
And we don't, as doctors, ever observe the color of the poop in isolation. If your baby seems to be bothered by something, and then all of a sudden it changes from the yellow to that more reddish tinge, that's a sign likely something's going on. You need to get your baby checked out.
And there's one more color that we don't have here, and it doesn't happen very often, but white. If a baby is consistently having white stools, that's actually a sign of a pretty significant liver problem, and you definitely want to tell the doctor about that.